All right, folks, how you doing? Russell, TrueResults303.com. Check out the website. Subscribe to the free newsletter. Get instant updates when material is posted to the website or YouTube. Check the description box. Look at some of the links on how you can contact me through social media. Coming at you today with a video on low back pain. I'm doing a series on pain in general throughout the body and how to relieve that pain through exercise. So check that out. That's on somatics. But today we're going to come with some deep tissue release of the hip joint when we have lower back pain. I did a video on lower body foam rolling. This is going to just be kind of an extension of that, focusing on the hips. So when we have a lot of back pain or lower back pain, hip pain, it can be, once again, due to overactive muscles and those muscles being tight and in a state of contraction. Through massage or foam rolling, we can loosen up those muscles ourselves. So first, I've got my little textbook here. Going to show you these muscles that we're going to be trying to hit. These are going to be the deep muscles of the hip. You can see right there if it's going to focus in. Up here, we've got the glute medius and glute minimus. And then down here, we got the piriformis and a bunch of other ones that I do not know how to pronounce properly, so I'm not going to try to. These are usually going to be the issue muscles, the piriformis and a bunch of these ones right here. Those are usually going to be the issue when we are experience a lot of hip pain and low back pain. So I'm going to go in depth here more of what we can do to try and release these muscles when they are stuck in that state of contraction and we are having pain. So I'm going to lower the camera here. All right, once again, like I said, this is going to be foam rolling, deep tissue. So here we go. I've got my foam roller. I've got the small one, the hollow one. This is the one that I would recommend. You can get a larger one, of course. But, so first, this was on the foam rolling video. So check that one out, lower body. So what we're going to do is we're going to sit on it, whichever hip that we are deciding we want to start with. That's the hip we're going to roll onto. That leg we're going to cross up and over. And now we can come down to an elbow. We can stay up, whichever we like. And we just roll around in it, trying to find those tender spots. For me, I'm having left hip issues right now. That is why I chose the left side. Now for me, this is nothing. I feel no discomfort, no pain. Those are deep tissue muscles. We've got to get through the gluteus maximus first to even get down into those muscles. So sometimes this is not going to be enough. This is not going to be able to pinpoint those muscle groups. So try it, see if this works. If this works, this is great, stick with it. But sometimes that's not going to work. Next, we're going to whip out the softball. This is what I usually use just because I'm used to performing this movement, and this is the only thing that can work for me. So same thing, we're going to set it up under the glute, the hip. We can start just right here, and we can just start to move around in it until we find a tender spot. When we find it, kind of sit on it, relax. We want to breathe. We got to make sure that we're breathing because this muscle is stuck in a state of contraction. If we're holding our breath, the body tenses up. We need to make sure that we are breathing and just trying to enjoy what's going on here. Same thing, get a little bit deeper. We can now cross that leg and work into it. For me, right there is that tender spot. And just sit on it once again and roll around on it. Oh, and that's a tender spot. That's a tender spot. Once again, for me, this sometimes it gets the job done. Still not good enough. I like to bring out the lacrosse ball, a baseball. This is actually a hockey ball. It's not a lacrosse ball. It's an outdoor hockey ball. But same thing. Up under that hip, cross that leg, and now we're digging in, and that is a lot worse. Woo. So now we're here. We're digging it in. We're releasing it. But what I like to do as well is bring that leg down, and now I'm just moving through movement, trying to attack that muscle from a different angle, and it's just finding which movement works best for you. Move around, get it moving. bring it through, back up, just really attacking that. So now that we've had it all broken up and we've attacked that muscle, trying to loosen it up, now we need to go into some stretching. So what are the best stretches for this? First of all, you can just come in just like this, bring that foot up, and just sit back like that. Lean into it a little bit. Just like that. That's what you can do. You can put it up on a bench, on a table, anything like that. Focus on sitting down deep into that. The objective too is not to be churned like this, because now we don't have that stretch. We need to go ahead and churn into it. Get that deep stretch coming down that hip and that glute that we just loosened up. Next thing, we can come in here, cross that same leg here, and then we're pulling. Same thing, just feeling for that nice stretch, breathing. The next thing we can do that I like to do, we have the erector spinae muscles going down each side of the spine. What I like to do is here, and then just roll onto that one side a little bit. And for me, I get a deeper stretch. And once again, it's breathing. Nice in and out, deep breaths, letting that muscle relax. If this is too hard, you can put your feet up against a wall like this, cross it, and then we can just lift our leg off the wall if we can't reach through and grab and pull. So you would just come up to a wall, set your feet on the wall, cross that leg, and then just pull your leg back off the wall, and then hold it. Then we can also push down. You can do the same thing if you're sitting on a bench. You can just cross it if you're sitting on a bench, and push. Once again, if it is a chronic area, this is an area that we're going to have to work on consistently until we gain control of the problem. All right, so there we go. This is going to really attack the deep tissues, the deep muscles of the hip joint, releasing the tension in this and reducing back pain. So this is something that if we can do consistently, hopefully this means we can prevent the issue. But if we already have the issue, we still need to do it on a regular basis. And then we need to try and stick to it and doing it once or twice a week. Right? So thank you for watching. Share these videos. Like these videos. Let people know that the channel's out there and available. You know, we're trying to help others. That's what it's all about. Helping everybody become healthier, fitter, stronger, better in general. And thank you for watching. Stay tuned for another video.